I've got caught up in my own... I apologise to all members. That question has been put down to the bottom of the question sheet. I do apologise. Question number 6, the Honourable Ruth Dyson.
Does he stand by his statement, quote, "But when you're Minister of Health, part of making sure you know what is going on is making sure you are out there seeing things from a patient's perspective"?
Honourable Tony Ryle.
Yes. As Minister of Health, I regularly visit rest homes, hospitals, GP clinics and speak with the public and patients.
Order. Could I simply ask the Minister to repeat his answer for me, because I couldn't hear it at all.
Yes,
Order.
as Minister of Health.
Order. I apologise to the Minister. On this occasion, I would ask the opposition, though maybe dazzled, to please keep the noise down so that I can hear what I'm sure is an important answer to the Honourable Ruth Dyson's question. The Honourable Tony Ryle.
Yes. As Minister of Health, I regularly visit rest homes, hospitals, GP clinics and speak with the public and patients.
The Honourable Ruth Dyson.
Why didn't he take the perspective of 94-year-old St Kilda pensioner John Curry, who says that nervous exhaustion through worry about the cuts to his home help have put him in Dunedin Hospital?
The Honourable Tony Ryle.
Mr Speaker, I am aware of that case. I would say that the DHB has assured me that no one will be unsafe or forced out of their home because of the changes made to home support, and I understand that the District Health Board has been in touch with him, and other facts were revealed in the article today.
The Honourable Ruth Dyson.
Which mental health patients did he seek out for their perspective on the $5 million cuts to community-based mental health services in Wellington this year?
The Honourable Tony Ryle.
Mr Speaker, I think the people that I have spoken to who are involved in mental health are very impressed that $174 million extra will be put into mental health services over the next 4 years.
The Honourable Ruth Dyson. Well, they'll go to the Dr. Paul Hutchison.
Thank you, Mr Speaker, to the Minister of Health. What reports has he had in relation to the patient's perspective on improved ambulance services?
The Honourable Tony Ryle.
Mr Speaker, I can inform the House that as part of the government's $48 million extra investment over 4 years to support the National Ambulance Service, there are now an extra 100 paramedics on the health front line. Mr Speaker, this means more communities have 7-day-a-week, 24-hour cover. Reliance on volunteer staff is reduced and the average number of ambulances available both day and night has increased. We now have extra paramedics in more than 40 centres throughout the nation, from Dargaville in the north to Gore in the south, supporting better and safer frontline services for New Zealand patients.
The Honourable Ruth Dyson.
Which children and young people did he seek for their perspective on the fact that South Canterbury District Health Board is cutting their child and youth oral health services by $1.2 million this year, cuts signed off by him?
The Honourable Tony Ryle.
Mr Speaker, what's quite clear in the South Canterbury area, they have had additional funding of $11 million in the last 18 months, and the District Health Board is improving frontline services for people in that area quite strongly.
The Honourable Ruth Dyson.
If he's concerned about seeing things from the patient's perspective, will he use his ministerial powers on behalf of Otago and Southland patients to keep their neurosurgical services?
The Honourable Tony Ryle.
As the member well knows, all of the South Island District Health Boards are aware that they have to fix the situation at Otago Southland. In the last term of that government, 3 neurosurgeons left the hospital. We know that a patient recently explained that she'd had 3 locum neurosurgeons in 4 months. The District Health Boards can't agree on the service network across the South Island. They've asked the Director-General to arbitrate, and an independent panel is looking at this case. I have to say, like the people of Otago Southland, I'd have to be convinced that they don't deserve good quality neurosurgical services.
Question number 7, Heke Parata.